And you're back with me, Raj Arya, once again with Mr. Prem Kumar Shanmugam, the Clinical Director of Solace Sabah, in our second part of this interview. Now, earlier, before we delve into Solace Sabah with more specificity, I understand that prior to you setting up this 6-star resort center, that if someone was looking for similar services, similar ambience and all that, they would have to go overseas. Can you just share with us a bit more about that?
Sure. Well, the only what you call a professional treatment approach that is available in this region, would be, prior to Solace Sabah, would be Australia. There are a few rehabs in Thailand as well,
right?
And that's it. Okay. Of course, there are people who set up rehabs and claim that they can treat and they can do lots of stuff, but I wouldn't get into that, and I wouldn't be too confident about it because they can be risky as well. All right. They use very odd methods of treating, which we know doesn't work. But prior to this, the only place that you would have to go is either Australia, the closest ones, Australia or Thailand.
Right, right. Now, coming back to this, what was the purpose or the motivational factor for you to actually set up Solace Sabah? Okay.
Now, well, being in this field myself, it has always been a drive for me because I've seen changes in families taking place. I've seen that wonderful moments where the mothers or the wives or even the husbands shed tears when they say, oh my God, they have stopped. And life transforms only not for that individual, it transforms for everybody who's associated with them, with that one person. It's amazing, what recovery does. And this person who has been a drug addict or an alcoholic for half his life suddenly has all this energy and has all this need and passion to become a better person, a better individual to the society, because he's so excited, oh my goodness, I can quit. No one told me I could. Look, whatever I did was not my fault. I'm not actually a bad person. Can you imagine that, the impact that it will have on you?
Right.
It's a result of the addiction. Well, it doesn't mean that you don't have to take responsibility, of course, right? But some of the things that you had done as a result of the addictions, now you can come into recovery and take responsibility, and make amends and do the right things. All right. So that was one of the drives that motivated, a few of us. Now, I went to Sabah. I used to go to Sabah, Kota Kinabalu, quite often to see patients there, to see clients there. Right. And I had the opportunity to meet a very passionate individual there, and I have to mention him. His name is Datuk Sri Panglima Dr. Haji Gulam Said, a visionary, and he's an academic himself. So he runs schools. So he teaches children, educates children about life and education and blah blah blah. And he started seeing children getting into drugs. Okay, so we were talking, and then he said, "Look, wow, there is a need for this center," and I had this passion and the dream to do this, so we just clicked.
Right.
And why KK? If that's going to be our next question.
You read my mind.
Well, it's beautiful there. It's just amazing. It has got all the needs of a place to go and get well. Right. It's got a therapeutic environment, I must say. The sea, the jungle, the natural setting that you have there, the large greenery, and all the activities that we can offer to guests who come for treatment, especially the sea spots.
Right.
Now we have to understand, addicts or people who have addiction problems, when they come into recovery, they suddenly have this burst of energy.
Right.
And we need to help them burn that adrenaline,
Harness that energy in a more positive
way.
That's right.
Some of them actually do get hooked on to that. They start going to the gym and they start building, buffing their muscles up and start building. Some become, some running, they take up gymming and all that. So KK provided this opportunity. Kota Kinabalu had all these facilities.
And I think that's a great way as well, because it takes you away from the hustle and bustle, from the city life, the congestion, the complexities and all that kind of thing, right?
Plus, when we treat celebrities, now like you said earlier, we're treating celebrities, people who are well known and do not want to be known.
That's right.
We have to assure them the anonymity,
Right.
So Solace is actually located in a place where you wouldn't even know there's a rehab there. You wouldn't even know it's a resort, for that matter. It's surrounded by jungle and it's very well protected.
Discretion is very crucial, right?
Essential. So we assure them that we will take care of them. In fact, we have security for all our guests. We actually go to the airport and fetch them and bring them in, and then we send them out. You can't get a taxi or a cab or any kind of local transport to find us because they don't know where we are.
Right.
So if you look at our website, you don't get an address.
Just a phone number.
Just a phone number and a contact email, of course.
Right.
Yeah.
Right. So speaking of which, you mentioned about celebrities. Who are essentially would be your target market?
Okay. Now, actually, we are very international, and we have opened up to the world. And I'm beginning to see more and more recently, lots of inquiries coming in from even USA. This morning, I had a chat with someone from USA as well, yeah, seeking treatment. Australia is the nearest, I would think,
Right.
because Australia has got direct flights to Kota Kinabalu, Hong Kong, and most recently Korea. So we are very international market. Now, we must also understand that the foreigners, the Americans or the British or the Canadians, they love our, the Asian weather, they love the climate here. And of course, cost-wise, it's going to be way lower than what they're going to pay there.
That's true.
Plus, we can give them equally or better treatment facilities.
Right. This seems to have fallen into the ambit of medical tourism, which
It
is
has.
actually big business in this part of the world
That's
as
right.
well.
That's right. Malaysia is actually one of, if I'm not mistaken, is top 5, I think, in as far as medical tourism is concerned.
right.
Yeah, because we do provide fantastic services
That's right.
in medical tourism. We have experts in the country. We have professionals in Malaysia, but unfortunately, addiction treatment is a new field. And I think only now people are beginning to open up to the concept of treatment. It used to be, I would think, punishment or cold turkey, like what you mentioned earlier,
That's
right?
right.
Now people are beginning to realize, I can get well, I can be treated. Yeah.
Right.
So we are trying to serve the need for the society, not only in Malaysia and Singapore or in Southeast Asia, but also around the world as well.
Okay. Now, one very important point which you have emphasized on right now, treatment is so crucial. It's so important to get it right. So how do you do it differently in Solace Sabah compared to other more traditional rehabilitation centers out there?
Okay. Firstly, like I mentioned earlier, we are using a scientific and evidence-based approach. Okay. That means, okay, let me talk a little bit about the program.
Sure.
Maybe that might help. Now, they get up in the morning, okay, then there's activities throughout the day, so it's a very structured program. Now, people who have an addiction problem, they need to have a structure in the daily activity to fill up, the structure of taking drugs or getting addicted. That's already a structure by itself. Now we've removed the addiction, we've got to fill it up with something else.
Right.
We're creating a void. So it's a very structured program. We have group activities, group counseling sessions or other, but you need to come to group, and you're in a group of other recovering people, and you'll be challenged by the rest. So that's like, hey, you sure you're being honest about what you're saying? Come on, when I know better, that's not the truth. Peers challenging each other is one of the best ways of seeing change happening.
So this is peer pressure on a more positive, more positive light.
way.
Yeah.
Of course, it has to be facilitated by a professional.
Right.
Yeah, and there are topics. Now we have actually written up a manual. I've written up a complete manual for this program, and like I said earlier, the program has actually been accredited, as having international standards. So every day there is an activity they need to do. There's a topic that they need to discuss. There are assignments that they need to fulfill, and then they present it in group. All right, and the group challenges them. After that, they also have one-on-one counseling sessions. That means a therapist and the client together will have sessions. This happens at least 3 to 5 times a week, the one-on-one sessions. More personal. Childhood issues. There could be family trauma, there could be a history of issues. That addiction, sometimes we say, is only the symptoms. There are baggage of issues that has caused this.
The trigger, right?
Yes. Like I said, it could be trauma, it could be genetic.
Right.
Now research shows that addictions is also has got a genetic predisposition as well. So the one-on-one therapy helps with that. Okay. Then we also offer something called alternative therapies. Now this again is something unique. Alternative therapies would be things like hypnotherapy, meditation, yoga, acupuncture, and some of these alternative therapies may work well with some of them. So the therapist and the guests together, they identify what kind of alternative therapy he wants to go for. Okay, and then that is complemented by the activities, the C spots, the outings, the adrenaline rush giving activities. So it's a very a program which is holistic. Plus, we also have fitness. We have you will have your own personal trainer. You will have your own nutritionist. We have to understand that this addicted person, would have neglected his health, either not eating at all or eating too much.
Right.
So there has to be a balance. Would not have exercised, so there has to be a balance. So all this is worked out into the program. Again, I think a very important thing that we have in the program is the continuing care. Okay, we have managed to put together an 18-month or 1.5 year continuing care program once this person is discharged.
Right. That's
So
very crucial, right?
It
to
is.
make sure the
It
follow-ups
is,
and
yes.
all that.
Like we talked about maintenance. Stopping the addiction is only the first component.
Right.
Maintaining a drug-free or addiction-free
Actually, that's
life.
the easy part.
I would think so.
Staying
Yeah.
out of addiction, that's
Yeah.
the more challenging bit.
That's
right?
the more challenging bit, you're right. So we have worked out an 18-month program where this person, even after his discharge and he physically leaves Solace,
Yep.
we are able to help him on his continuing care. We have set up satellite clinics in Australia. We have set up a clinic in Hong Kong, Macau, Singapore, Kuala Lumpur. So we are, establishing contacts and networks throughout with experts who are addiction trained to be able to help this person when he goes back.
Right, right.
Yeah, so I mean, in a nutshell, that basically is the unique program that we have.
Right, makes a lot of sense. Now you mentioned looking at it from a holistic perspective.
Mm-hmm.
What about medication? How big a part does actual medication play in this treatment process?
Okay, now addicts, people who have an addiction problems, most of the times also have something called comorbid disorders. Okay.
Okay.
Now comorbid disorders are things like depression, anxiety, very common.
Yeah.
Okay, a heroin addict or a meth addict may have depression problems. So his psychiatrist or doctor would have probably prescribed medications for him
Sure.
to manage that. So we will continue with that. And our psychiatrists or our medical people will always work with whoever else is referring the guest from overseas to make sure that he's medicated. Ideally, the goal would be to get them off any kind of dependency.
Mm-hmm.
But again, if it's a medical need, of course, we'll have them to continue their medication.
Right.
Yeah. So yes, to answer your question, medication is part of the program as well.
Right, right. Okay, I understand that Solar Sabah is extremely new, just up and running
Right.
very, very recently.
Right.
In this recent time, how has things been going?
Oh, very encouraging actually.
Right.
Lots of inquiries, sort of referrals coming in.
Mm-hmm.
So we are actually trying to manage the referrals coming in, which is a good problem to have, I think.
That's right. That's right.
And we have already started operations on a sister site. We call it our relapse prevention unit.
Okay.
And we have guests who are coming in and seeing the change happening. They're so in shock that they're staying on for the second month and third month.
Mm.
We already have people who have booked in for 3 months who want to come in and stay 3 months with us. So it's a lot of good things happening, seeing the families come together. Another important component which I forgot to stress on our program is the family component. Okay. Now we also think, and I think it's a fact, addiction is also a family disease. Not only the addict suffers, the whole family suffers.
That's true.
Now if you treat the addict and he goes back to the family which is untreated, the chances are high he's going to relapse.
Relapse, yeah.
Right? The family needs to be treated as well on how to cope with this new person,
That's right.
how to manage his expectations.
Right. Must be a conducive environment for him to go back
Exactly.
to. Right?
So we have consultants and family therapists coming in from overseas monthly, once a month, where he will spend time with the family to conduct family workshops,
Right.
to train them, to psychoeducate them, and to explain to them the do's and the don'ts, the expectations. The families will have expectations. Now my husband is coming back home, he's sober, wow, fantastic, all problems are solved. So we have to manage the recovering person's expectations and the family's expectations. Has to be realistic.
That's right. Very, very important.
Yeah.
Now, you mentioned just now 18 months of continuous support after he leaves.
Mm-hmm.
Essentially, how long does a person need to be at Solar Sabah in the initial stage?
Okay, now ideally, for some kind of change to happen cognitively, it would take 90 days.
Right.
Okay, and then so we say the first 3 months is essential, then the 6th month is essential, and then the 18-month period is essential.
Yeah.
Now, based on some of the experience and some research, this is the crucial period where change happens.
Right.
Okay, but it's difficult to say it's a 3-month program because people cannot afford to get away for 90 days,
Sure.
especially those who are working, who are
That's
experts. So we have tailored it in such a way that it's a 1-month program. Okay, people come in, they stay on. By the 3rd week, they see the changes happening. They say, "Wow, this is fantastic! I'm staying on for the 2nd month."
Right.
Okay, normally you will see changes happening in the 2nd and 3rd week, where they realize, "Fantastic! I'm sober." Then what's next?
Right.
How to stay sober? Okay, so yes, to answer your question, the reason why we tailored this 18 months is because we know once they're discharged,
Yes.
for the next 18 months, they have to be monitored. After 18 months, it doesn't mean you're recovered. Now we say in treatment, a recovered addict is a dead addict.
That's true. That's true.
It's safer to say I'm in recovery.
Yeah.
Because there's a possibility I could relapse anytime. I could go back to my old behavior, then it's another cycle altogether.
That's right, back to square one.
Yeah.
All
So it's safer for me to say I'm in recovery and I got to do all those things that I'm not supposed to do or I'm supposed to do to stay in recovery.
Right, right. Okay, we have almost run out of time right now. Prem, if
Sure.
someone would like to find out more information about the programs, about Solar Sabah, where can they find out this information?
Okay, you can go to our website,
Right.
www.thesolacesaba.com.
All right.
Okay, and call us, email us, or call me directly. My number is 019-715-4686, or my Singapore number is 65-9339-33928.
That's right.
Yeah.
And privacy and confidentiality is
Is
100% guaranteed, right?
Guaranteed, definitely.
All right. Prem, thank you very much for
Thank
your
you,
time
Raj.
today.
Thank
It
you.
has
It
been
was
a pleasure. There you have it, a bigger insight in terms of what needs, if you're facing addiction problems, and the solutions available out there right here in Malaysia itself. With that, we're going to take another quick commercial break right now. We'll be back with more corporate news, business developments, and of course, riveting interviews.